Hi, this is Dr. Daljeet Kaur. I'm a consultant psychiatrist and founder of HealthyMinds and Dawn Welfare Foundation. I'm back here with you guys again talking about some other topic on mental health awareness. Today we would be talking about schizophrenia. What is schizophrenia? Schizophrenia is a serious mental illness that affects the thinking, emotions, and behavior of people who suffer from it. It is the most common form of psychosis. Over a lifetime, about 1 in 100 people would develop schizophrenia. It is most likely to start between the ages of 15 and 35. However, some people might suffer with it, say over 60 years or later when it is called as late onset schizophrenia. The illness might last for a long time and can affect a person in different ways depending on the symptoms. Let us talk about the symptoms of schizophrenia. Schizophrenia affects people in a different way. Symptoms can be described as positive and negative. The positive symptoms could be of delusions. Delusions are basically strange beliefs which are strongly held by people that are not only untrue but also might seem quite bizarre to the ones who are hearing about it. The common ones are persecutory delusions. So people might feel like someone's actually trying to harm me, someone's watching me through cameras and so on. Thought disorder. Thought disorder is when someone is not thinking straight and it is hard to make sense of what they are saying. Their ideas might be jumbled up. When psychiatrists comment about formal thought disorder, it could be that people are thinking, the planes are being hijacked, these people are being monitored, there are cameras watching them and so on. This is one example of thought disorder. Hallucinations. Well, when someone sees, hears, smells or feels something that isn't really there, these would be hallucinations. The most common hallucination that people have is hearing voices. In schizophrenia, hallucinations are totally real to the person who's experiencing them. The hearing voices part is called auditory hallucination. When someone sees something, that is called visual hallucinations. People who are having these experiences might actually act strangely. For example, they might talk or laugh to themselves or appear to be talking to somebody that you can't see. So when you find people just mumbling or talking to themselves, there is a possibility that they might actually be hearing some voices in their head talking to them or asking them to do things. Now let's talk about the negative symptoms. The young person suffering from schizophrenia can become withdrawn and appear unemotional. So these are the common negative symptoms. It might feel like there's not much expression on a person's face, they're not that emotional, they lack motivation, they might not be able to carry on with their regular activities, work or study. How can you help someone with possible schizophrenia? The earlier it is recognized that a person is ill, the better the chances of getting effective treatment. This speeds up their recovery too. Therefore, we always propagate early intervention. How can we treat schizophrenia? Medications called antipsychotics are an important part of the treatment of schizophrenia. They treat the symptoms of the illness. Unfortunately, symptoms of schizophrenia can recur and may need long-term treatment. It is possible for a person with schizophrenia to have a decent recovery and function well in the community. So what I want to tell you guys is, although schizophrenia is a severe and enduring mental health illness, when treated properly, it can actually improve the quality of life of a person and they can enjoy their life just like us. I mean, obviously, there is a difference in the severity. Some people with schizophrenia might need to be admitted to the hospital, while others might have very minimal symptoms and may be able to function really well. I have quite few patients who are doing very well and doing their PhDs and functioning absolutely fine despite having symptoms of schizophrenia. The thing to remember is not to stop your medication by yourself. Always monitor with a psychiatrist, and it might be required that you will need to be on a maintenance dose of medication for quite some time. Psychotherapy is also effective. It helps you developing insight into the issues and would also help you in dealing with the voices and so on. I hope you found this information on schizophrenia helpful. It might be that you want to know more about other mental health issues, and if that is the case, please subscribe to our channel and keep making suggestions. I'll be here talking to you about other topics. Have a good day.